nationwide lockdown as coronavirus infections rise. It's the latest country in Southeast Asia to stop a surge in COVID-19 cases. The country is reporting on average more than 2,400 new infections every day.
Hari ini sebanyak 1,924 kes baru.
235 kes baru yang telah dilaporkan.
As we are all aware, the COVID-19 pandemic profoundly impacted healthcare systems worldwide. Malaysia was no exception. The pandemic heightened the need for safe and remote healthcare access. Restrictions on movement and social distancing measures made traditional healthcare visits challenging. To address these challenges, Malaysia experienced a rapid uptake of telehealth services. Various healthcare providers and platforms swiftly introduced teleconsultation services. As instance, MySejahtera has expanded its utility beyond its initial focus on contact tracing and COVID-19 management. The application has diversified its usage to encompass various health-related aspects and initiatives. MySejahtera also facilitates access to healthcare services by allowing users to locate nearby healthcare facilities, book appointments, and access teleconsultation services, thereby promoting easier access to healthcare resources. Now, let's dive into the definition of the telehealth. Based on Malaysia Telemedicine Act 1997, telehealth refers to practice of medicine using audio, visual and data communication. Based on this study, telehealth is a term used widely nowadays in conjunction with better ICT growth in the healthcare delivery. It integrates the use of telecommunication and information system as well as multimedia technologies to promote healthcare delivery and create health plan for the individual. However, the rapid adoption of telemedicine in Malaysia has brought to the forefront various ethical considerations within the realm of public health ethics. Now, let's look at the scenario.
I'm a doctor in the hospital, and I saw that you had booked an appointment for teleconsultation.
Yes, I did book an appointment because I'm not feeling
Right.
well.
Can you switch on your camera, please, madam?
Sorry, I'm not sure how to do that.
Oh dear.
Even to book the appointment, I need my children's help.
I see. There's no one else at home?
First ethical consideration involve informed consent. In telemedicine, media literacy is crucial to ensure patients comprehend the limitations and capabilities of remote consultation and digital healthcare platform before giving their informed consent to participate. Since telemedicine might seem unfamiliar to some people, this might actually challenge the ethical principle of informed consent.
I see.
Yeah.
Okay. All right, but it's okay. Since we already booked this slot, what's wrong with you, if you don't mind telling me?
Actually, I'm having fever for past 2 days, headache, and there is like pimples appearing in my body, the whole body, and my whole body is aching. I'm not sure what is wrong with it. That's why I'm calling to book a slot with.
When observing the situations, it is noticeable that the doctor isn't the only person present, indicating a concern about keeping diagnosis confidential. In healthcare, it is crucial for healthcare providers to protect patients' medical information and keep it private. Specifically in telemedicine, ensuring secure system and procedures is vital to protect patients' data and diagnostic details, maintaining this important confidentiality principle.
Not sure what is wrong with it. That's why I'm calling to book a slot with the doctors there.
Okay, so you have fever and a pimple on your. You have a pimple,
Yes.
right? Okay, right. And
Pimple.
any cough?
No cough yet, but slightly I'm having a runny nose.
Okay, so you have runny nose. Okay, any joint pains anywhere?
Yes, my whole body is aching and I'm having headache.
I see. Okay, all right. Let's see. Okay, now your any redness on your body?
Yes, the pimple is turned out to be like redness, and then look like something is inside the pimple. And then my whole body is very pain, and I'm not feeling very well.
What do you mean something inside the pimple?
It's, I don't know, maybe something like water is coming out.
Okay. All right. Tell you what, madam, I'm not so sure what it is. Since you're having fever, do you have Panadol at home?
Yes, I've been taking that Panadol for past 2 days, and it's not recovering.
Okay, I
So
see.
that's what.
I need to actually see what you're having. Is there any way you can come to the hospital?
Well, I'm not sure, but I will ask my children regarding this, and maybe I'll call you back.
Okay, why don't you try, because our appointment slot is also finishing. Why don't you try and come? But if you're not better, continue taking paracetamol. And if you're still worse, tomorrow come back. But I'd rather you come so that I can see you, because I cannot see you on camera. Okay?
Right.
This issue addresses the principle of beneficence and non-maleficence in medical ethics, where the possibility of misdiagnosis in telemedicine raises ethical concerns about ensuring accurate diagnosis and minimizing the risk of harm to patients, emphasizing the importance of maintaining diagnostic accuracy and quality care standards in remote consultation. Oops, but wait, did you know that Malaysia is a multiracial country where individuals might be fluent or moderately proficient in different languages? This diversity sparks the issue of language barriers in healthcare, particularly in telemedicine. This situation can lead to challenges in effective communication between healthcare providers and patients, potentially affecting the quality of care and understanding during remote consultations. Now, let's listen to Prof. Norris on potential strategies to mitigate these issues.
To address the challenge of patients' lack of media literacy, it's essential to focus on education and user-friendly interfaces. Developing educational materials that explain the telehealth process, how to use the technology, and what to expect during a virtual consultation will be a big help. These materials should be easily accessible through various mediums such as websites, videos, and pamphlets. Additionally, telehealth platforms should be designed with user-friendly interfaces as well, providing clear instructions and guidance throughout the virtual visit. Consider implementing tutorials or onboarding sessions to familiarize patients with the technology, ensuring they feel comfortable and confident during telehealth consultations. Also, the lack of computer literacy may affect the patient's informed consent process. She may not understand the contents fully. In that case, you may want to have the process non-digital and in-person. For instance, at University Malaya Medical Center, we need to explain about teleconsultation face-to-face to the patient first, and the informed consent form has to be signed on paper. This is also to make sure that the person signing it is the actual person and not someone else. Confidentiality is a cornerstone of telehealth, and maintaining it during telehealth consultation is crucial. You may start by ensuring that the telehealth platform complies with robust security standards and regulations. Implementing end-to-end encryption, secure login procedures, and secure data storage will be essential. Clearly communicate to patients about the security measures in place, assuring them that their personal health information is protected. Additionally, train healthcare providers on best practices for maintaining confidentiality during virtual visits, including creating a secure and private environment for the consultation. It is also desirable to have a regular monitoring and audits to assess if the telemedicine practices meet with ethical standards. To mitigate the risk of misdiagnosis in telehealth consultations, emphasize the importance of thorough communication between patients and healthcare providers. A special training on telehealth for healthcare providers should be considered, implementing pre-appointment questionnaires that patients can fill out. Providing detailed information about the symptoms and medical history is a good idea. Try to encourage open dialogue during virtual visits, ensuring that patients feel comfortable expressing their concerns and asking questions. Leverage technology such as high-quality video and audio to enhance the clarity of communication. Additionally, consider incorporating remote monitoring devices to gather objective data, providing a more comprehensive view of the patient's health status. Addressing language barriers in telehealth involves implementing effective communication tools and language support services. You may consider to offer multilingual support on telehealth platforms, allowing patients to select their preferred language for the consultation. Utilize real-time translation services or employ multilingual healthcare professionals to facilitate effective communication. Make sure the use of plain language in written materials and instructions. Ensure that interpreters are available for patients who require language assistance, and promote cultural competence among healthcare providers to enhance understanding and trust in cross-cultural interactions.